Welcome to today's Explainer. Okay, let's jump straight into this because what we're looking at today is literally life-saving information. We're breaking down exactly how to spot the early, and I mean really hidden signs of an eating disorder. As someone who loves diving into human behavior, I'm always looking for patterns. And the stark truth about these conditions is that the most vital patterns appear way before any visible health crisis hits. So today, we're going to unpack how to catch those subtle behavioral shifts early on, which honestly gives you the absolute best chance to intervene when it matters most.
Picture this, because it's a remarkably common scene. You're in the kitchen and you notice your teenager is skipping breakfast. You ask them about it, and they just shrug it off, saying, "I'm just not hungry in the morning." It sounds perfectly reasonable, right? We've all been there. But then, the lunchbox starts coming home totally untouched. Or maybe your kid suddenly wants to cook these massive, elaborate meals for the whole family, but mysteriously, they don't eat a single bite of it themselves. Sure, on their own, these sound like isolated quirks. But in reality, these innocent-sounding excuses are incredibly often the very first dominoes to fall. And that perfectly illustrates what we call the hidden crisis. It helps to think of an eating disorder like a giant iceberg. We are so conditioned by society to only look for the very tip of that iceberg, the dramatic physical changes. But the real danger, it's already thriving deep beneath the surface. It starts with subtly altered rules about what can and absolutely cannot be eaten. You'll see a sudden spike in secrecy and these totally unexplained, wildly shifting moods. Honestly, by the time you actually notice a physical transformation, the disorder has already dug its heels in deep.
Now, we have got to bust a major, dangerous myth right here. There is a stark contrast between the societal stereotype and the actual clinical reality. We've essentially been trained to believe that someone has to look extremely thin and usually be a teenage girl to actually be sick. The reality is vastly different. These illnesses do not discriminate. They strike people of every gender, every age, race, and body size. A child can be medically critically unwell at a low, average, or even higher body weight. The real early warning system isn't the scale. It's those noticeable changes in behavior and mood.
So what does this look like early on? Over time, those little innocent excuses build into incredibly rigid daily habits. You're looking for a cluster of changes creeping in. It's not just preferring one food over another. We're talking about repeatedly skipping meals, or portions just magically shrinking week by week. Watch out for the sudden, unexplained obsession with clean eating. Maybe they announce they're going vegan or gluten-free out of nowhere, and suddenly their list of safe foods gets smaller and smaller. You might even catch them chugging massive amounts of water or obsessively chewing gum just to cheat their own hunger. It is the intense rigidity of these new rules that really signals a problem. And speaking of rigidity, you really need to watch how totally normal preferences morph into intense food rituals. Notice if, all of a sudden, their food absolutely cannot touch on the plate. Or maybe they have to eat items in a highly specific fixed order, or meals must happen at exactly 6 p.m., not a minute later. But you want to know the absolute biggest red flag here? The reaction. Pay close attention if your child shows intense distress, anger, or outright panic if one of these arbitrary meal rules gets interrupted. That profound loss of flexibility, that tells you the eating disorder has taken the steering wheel. Now here's a crucial curveball. We must recognize that not all of this is driven by body image. Let's talk about ARFID, which stands for Avoidant Restrictive Food Intake Disorder. This one is fascinating because it completely flips the script on what most people expect an eating disorder to look like. Here, severe food restriction actually stems from sensory sensitivities, a super low interest in eating altogether, or a paralyzing fear of choking or vomiting. The desire to be thin literally has zero to do with it, and that is exactly why parents miss it if they're only on the lookout for body image issues.
Switching gears entirely, we need to address binge eating because there is a massive misconception here. Binge eating is not just having a big appetite or going totally overboard at a holiday party. Not even close. It is a deeply hidden, genuinely terrifying loss of control, which is immediately followed by a crushing cycle of shame and secrecy. We're talking about large amounts of food just vanishing from the pantry and finding food wrappers stashed away in bedroom closets, cars, or the bottom of backpacks. The person going through this is usually suffering in total silence, just weighed down by immense guilt.
That overwhelming secrecy often bleeds into what clinicians call hidden compensatory actions. Think about it. If you notice your teenager habitually vanishing into the bathroom the literal second dinner wraps up, or they constantly run the shower or the sink faucet to mask sounds, you need to pay attention. And purging isn't always vomiting either. It can look like the secret misuse of laxatives or diuretics, or even launching into a strict fast immediately after a meal to somehow undo the food they just ate. These are desperate, secretive attempts to claw back a sense of control.
Okay, now here is a behavior that slips right under the radar almost every time. Exercise. We constantly praise athletic discipline, right? Oh, they're so dedicated. But what makes this so insidious is that praised discipline can easily mask compulsive exercise. It becomes a major symptom when the movement gets rigid and secretive. Watch out for a teen who is training through sheer exhaustion, pushing through actual physical injuries, setting alarms for 4 a.m. to exercise in secret, or having a total meltdown if they are forced to take a rest day. If they are working out to earn the right to eat, that behavior has officially turned toxic.
Let's zoom out for a second and look beyond the plate. Malnutrition doesn't just affect weight, it impacts the entire body and, crucially, the brain. Physically, you might hear them complaining about being freezing cold all the time, having dizzy spells when they stand up, or you might even notice delayed growth or puberty. Emotionally, a brain that is starved of fuel becomes incredibly rigid. You're going to see heightened anxiety, really intense irritability, totally withdrawing from friends, and constant body checking, like repeatedly examining themselves in mirrors or begging for reassurance about how they look. The physical and emotional signs are totally intertwined.
All right, take a deep breath. We've just identified a lot of heavy, overwhelming signs, but let's pivot right now to the solution. Fortunately, if you are a parent or caregiver noticing these exact patterns, there's a calm, highly structured 8-part action plan you can rely on. And the best part, you don't need a medical degree to take these first steps. You just need to be observant and intentional. Let's break this plan down together.
Here are the first 4 steps. Number 1, document the pattern privately. Don't turn your house into a surveillance state, but keep a quiet mental or written record of those skipped meals and rigid rules. Number 2, choose a calm moment to talk. Do not do this in the middle of a screaming match at the dinner table. Number 3, describe exactly what you've seen without playing doctor. Just stick strictly to the facts. And number 4, express deep, genuine concern for their health and leave absolutely all judgment at the door.
Moving right along to the second half of our plan, Step 5 is absolutely crucial. Do not debate their appearance. Don't get sucked into an argument over whether they look sick enough. Step 6, arrange a prompt pediatric assessment based purely on those behaviors you've been documenting. Step 7, protect their immediate safety. If you know for a fact they're misusing laxatives, physically remove them from the house. And finally, Step 8, follow through. Show up to the appointments, stay involved, and if things get worse, keep going back. Getting into treatment early drastically improves their chances of full recovery.
So you're sitting down with them. What do you actually say? Well, you can use a beautifully simple, compassionate script right out of the gate. Try saying this: I've noticed that breakfast and lunch are often being skipped. You're exercising even when you're injured, and you seem really dizzy lately. Notice how utterly neutral that is? You're bridging the gap by just sharing the undeniable facts of what you've observed, completely stripping away the emotion and the accusations. You are simply acting as a mirror, reflecting their behavior back to them.
On the flip side, we need to talk about what will instantly blow up the conversation. Please, avoid throwing out heavy labels like "you're anorexic" or making wild accusations like "you're just doing this for attention." I promise you, that will instantly, and I mean instantly, shut things down. It backs the child right into a defensive corner. Remember your goal here. You aren't trying to win a debate or officially diagnose a psychological condition. Your only job is to open the door so you can get them to a professional.
Now let's be real. They are almost certainly going to deny there's a problem. When that happens, you need to be ready with a calm, firm response. You just say, "We do not need to agree on a diagnosis before we go see the pediatrician. I am not asking you to prove to me that you're sick." This is such a brilliant way to diffuse the tension. You are making it crystal clear that these health changes require a doctor's visit. End of story. You're taking the debate completely off the table.
I also have to throw up a massive red flag here, because well-meaning parents do this all the time. Please, do not turn that first conversation into a literal food trial. Don't grab a food they're terrified of, slam it on the table, and demand they eat it right then and there to prove they're fine. And absolutely do not drag them to the bathroom scale for a forced public weigh-in. All that does is escalate their panic, create trauma, and completely destroy the trust you so desperately need to actually help them.
Now, while we've been laser-focused on those subtle early signs, I'd be remiss if I didn't briefly but clearly mention the absolute emergency warning signs. If you are seeing fainting, complaints of chest pain, severe physical weakness, confusion, repeated vomiting, throwing up blood, or any hint of self-harm or suicidal thoughts, that is a drop-everything immediate medical crisis. If you're in the US, dial 988 for a mental health crisis or 911 for a physical emergency. Do not wait around for a routine Tuesday afternoon appointment if you see these severe symptoms.
As we start wrapping up our time together, I want to ask you a tough question. Are you waiting for absolute certainty before you step in? Look, it is completely human nature to want to be 100% sure before confronting a difficult issue, especially when it's someone we love dearly. But here is the hard truth about eating disorders. If you wait until the stereotype matches the reality, it means you have waited entirely too long. So here is your final and honestly most empowering takeaway for today's explainer. You do not need a tearful confession, and you absolutely do not need to see dramatic weight loss. If you have been paying attention and documented a pattern of changes, your concern alone is all the justification you need to start a professional evaluation. So as you think about the kids and teens in your life today, I leave you with this. If the earliest warning signs are completely invisible on the surface, are you looking closely enough at the behaviors beneath?